Good morning everyone, I am Dr. Priyanka and I am going to talk on update on Rho kinase inhibitors, the newest addition in our armamentarium. As you all know, glaucomas are a group of progressive optic neuropathies characterized by optic disc excavation and apoptotic loss of retinal ganglion cells. IOP is a continuous risk factor for the development and progression of the disease, and the only effective therapeutic intervention which helps in slowing the disease progression is IOP reduction. So there are two outflow pathways for aqueous humor. 85% is through the trabecular outflow and 15% is through the uveoscleral outflow. There are three mechanisms by which IOP can be reduced. The first one is by decreasing the rate of aqueous humor formation. Second one is by increasing the aqueous outflow through the unconventional pathway. And the third one is by decreasing aqueous outflow resistance of the conventional outflow pathway. So anti-glaucoma medications have evolved from 1877, starting with the cholinergic agonists and finally ending with the Rho kinase inhibitors till date. But none of the medications currently available to reduce IOP address the underlying cause of elevated IOP that is commonly associated with glaucoma, namely increased outflow resistance. So this led to the search for an ideal anti-glaucoma medication which can lower the outflow resistance, which is highly effective during both diurnal and nocturnal periods, which is easy to use, that is once daily dosage, well tolerated with minimal adverse effects, which has a neuroprotective activity as well as which can improve the ocular perfusion. So this led to studies by Dr. Benjamin Geiger and Dr. Paul Kaufman, who showed that cytoskeletally active agents such as latrenkilin and H7 significantly decrease aqueous humor outflow resistance. These studies began a focus on the role of cell mechanics in the aqueous humor outflow pathways and the role of Rho kinase in this process. So what are Rho and Rho kinases? They are basically, Rho is a group of small GTP binding proteins which aid in the regulation of cell structure, motility, division and apoptosis. Rho kinases are effectors of the Rho pathways. There are two identified types of Rho kinases referred to as Rho kinase 1 and 2. They aid in the reorganization of actin cytoskeleton which help in cell growth, movement and death. Rho kinases are ubiquitous and expressed in all tissue types. They are mainly serine tyrosine kinases. So this picture shows the structure of a Rho kinase. In the left picture, you can see the intramolecular interactions of the autoinhibitory loop, which maintain the molecule in an inactive stage. In the right side, you can see when GTP binds to Rho, it becomes active. And this active form of Rho binds to the Rho binding domain of the Rho kinase, thereby activating the enzyme. So once active, the Rho kinase phosphorylates myosin light chain, myosin phosphatase substrates, limb kinase, CP117, calponin, and the ERM proteins. These factors serve a number of cellular roles, including cell adhesion, actomyosin contraction, cell migration, and cell proliferation. Through the depolymerization of intermediate filaments and modulation of microtubule dynamics and polarity, Rho kinase acts to increase the contractile state and stiffness of cells, which play a critical role in the outflow of aqueous humor. So Rho kinase inhibitors increase the blood flow by causing vascular smooth muscle relaxation, leading to vasodilatation. This can cause a conjunctival hyperemia. They have an anti-tumor activity by inhibiting tumor cell invasion and metastasis, and they also prevent axonal degeneration and promote axon regeneration. Now, what are the indications of Rho kinase inhibitors in ophthalmology? There are 4 approved indications. First one is in cornea, which is Fuchs endothelial corneal dystrophy. In glaucoma, ocular hypertension and primary open-angle glaucoma, and also it has a very good action in diabetic retinopathy. What is the role of cytoskeleton in determining aqueous humor outflow resistance? The streamlines on which the aqueous humor passes through the juxtacanalicula tissue are forced to funnel or converge to enter the widely spaced pores in the inner wall endothelium of the Schlemm's canal. And this non-uniform flow significantly increases the outflow resistance. So Rho kinase inhibitors act by decreasing this Schlemm's canal cell stiffness and by increasing the number of pores, thereby decreasing the aqueous outflow resistance. The mechanism of Rho kinase inhibitors' ability to decrease IOP is through direct action on trabecular meshwork and Schlemm's canal. They also decrease reactive oxidative species damage to the trabecular meshwork, and they promote vasodilatation and improved retinal blood flow, especially to the optic nerve head. The commonly used Rho kinase inhibitors in ophthalmology, they act on both ROCK1 and ROCK2, Fasudil, Ripasudil, and Netarsudil. Ripasudil and Netarsudil are the 2 Rho kinase inhibitors currently approved for treatment in glaucoma. So coming to Ripasudil, it is a fluorinated analog of Fasudil but with more potent and selective Rho kinase inhibitory activity. It was approved in Japan for the treatment of glaucoma and ocular hypertension in September 2014. Ripasudil. And various clinical trials have established Ripasudil 0.4% BD as a clinically useful concentration and dosing frequency for the treatment of glaucoma and ocular hypertension. This solution, on an average, it can lower IOP by 2 to 4.4 millimeters of mercury 2 hours after instillation in patients with glaucoma or ocular hypertension, and they can continue to deliver statistically significant pressure reduction for at least 7 hours. Placebo-controlled randomized controlled clinical trials to evaluate the additive IOP lowering efficacy of Ripasudil with either timolol or latanoprose showed that treatment with Ripasudil resulted in a lower mean IOP in the timolol group, with the additive effect being 0.9 millimeters of mercury at trough and 1.6 millimeters of mercury at peak. In the latanoprose group, there was no significant difference compared to placebo. Ripasudil as adjunctive treatment in patients already on maximal medical therapy demonstrated IOP reductions ranging from 2.6 to 3.1 millimeters of mercury, or about 15 to 16% from the baseline. However, the side effects of Ripasudil include dose-dependent conjunctival hyperemia and non-dose-dependent conjunctival hemorrhage. Coming to Netarsudil, which is also known as Ropressa, it's a Rho kinase inhibitor as well as a norepinephrine transporter inhibitor. It is approved for use in the US to treat glaucoma in the late 2017. It lowers IOP by 3 mechanisms: by lowering outflow resistance, decreasing aqueous humor production, and by decreasing episcleral venous pressure, which is mainly due to the norepinephrine transporter inhibitory activity. It is more effective in patients with lower baseline IOP, possibly due to its ability to lower episcleral venous pressure. So this is Ropressa or Netarsudil. Intraocular pressure lowering effect has been shown to increase with latanoprost. This fixed combination of Netarsudil and latanoprost is known as Roclatan. The side effects of Netarsudil include conjunctival hyperemia, corneal verticillata, instillation side pain, and conjunctival hemorrhages. So this is the fixed combination of Netarsudil and latanoprost, which is called as Roclatan. Now coming to Rocket 1 and Rocket 2 studies, which are 2 phase 3 clinical trials comparing the safety and efficacy of Netarsudil to timolol in patients with elevated IOP, it has concluded that treatment with Netarsudil produced significantly and statistically significant reductions from baseline IOP and was non-inferior to timolol in patients with maximum baseline IOP of less than 25 millimeters of mercury in both studies. They also have a neuroprotection action on retinal ganglion cells. The Rho kinase inhibition results in enhanced axonal generation and increased blood flow. Thereby, they can slow the progression of glaucomatous optic neuropathy by by acting directly to increase the perfusion of retina and optic disc. Rho kinase inhibitors also have an effect on the conjunctival scarring after glaucoma surgery. Ripasudil acts by inhibiting the TGF-beta mediated increased expression of alpha smooth muscle actin. Thereby, intervention with a Rho kinase inhibitor could serve a dual purpose in post-trabeculectomy patients in that the drug could be used to lower IOP and to slow or prevent further scar formation. So to conclude, none of the Rho kinase inhibitors tested in various clinical trials proved themselves superior to commonly used first-line agents. However, they can be used as adjunctive agents since their mechanism of action is thought primarily to be one of lowering of aqueous humor outflow resistance and thus should be somewhat additive to the actions of other agents in clinical use. No known prior contraindications to the use of either Ripasudil or Netarsudil are found out, nor are there any known interactions with other medications. Thank you.
Thank you, Dr. Priyanka. For the next talk,